Hi there, and welcome to the Airplane Spoon podcast. Real stories and real questions about feeding children. I'm Sarina Murrell, feeding therapist and director of the Airplane Spoon. And today I want to talk to you about something that really bothers me. It really gets on my nerves. And on both sides, on the parent side and on the professional side. And this is the idea of assuming, making swooping generalizations or stereotypes, or not defending or standing up if you have differences or specific elements of how you're choosing to parent your child. Specifically, in this case, regarding feeding your child. So today's question can be, what are your family values around feeding your child? And if you're a provider, are you being open and considerate of these unique differences of family values when it comes to feeding their children? This is a touchy topic, and I want to talk about it because it is so prevalent, specifically for families that have different, maybe cultural identities, that there are so many assumptions or stereotypes that may not be true at all or might not even be known. And so they're not getting recognized or supported. And for parents, there's a lot of times that their wishes, their style, their values are dismissed. They might have brought it up and then it might have gotten dismissed. Or they just hear that this is the way it should be, and they think that what they were thinking the way it should be maybe is wrong, or they should change it. And with feeding, it's so touchy and more complex and complicated because there's so many different opinions out there. And I say opinions because not all of this is based off of fact or research. Like, there's so many different types of people across the whole world. And so there's lots and lots and lots of different styles of how to raise children and how to feed children. And children can be healthy and thrive and successful and happy in all of those different situations. There is not one right or wrong. So I want to give you some ideas today and think about this so that if you are a provider, can you be more intentional and open and non judgmental and supportive of the children and families that you serve? And if you are a parent or a caregiver who has to have these conversations with different providers, how can you state some of your values, some of your, hopes or intentions around feeding your child in a way that's not necessarily confrontational, but it's also not you just biting your tongue and holding them in and feeling like you can't really say anything about it. Okay, so let's jump in. The first one I want to start with and thinking about is basically when a baby is born. When a baby is born, they need to eat. And the biggest question here is around, breastfeeding or bottle feeding. And I guess the first question would be not can, if there is a mother, sometimes there's not breast milk available if it's, gay dads, if it's an adoptive case, different things where maybe there's just not a mother present. Maybe the mother died during childbirth. Things happen. And so if there's not human breast milk available, then it's a little bit assumed that it's probably going to be formula. Some people do seek out milk banks to get breast milk. But I guess the first question would be, do they want to provide breast milk or do they want to provide formula? But even before that, there's an assumption. There's an assumption that the mother not just wants to, but can. There are women that just do not want to breastfeed. And there's nothing wrong with that. That's a judgment choice that every person can make. And we don't need to know why or why not. It's just to respect that. But is it asked? Is it asked in the first place? Or is it said on the parent side in the first place? We don't want to try breastfeeding. We're just going to do formula. That's fine. There are options out there. But to assume that every woman wants to do breastfeeding, but most often than not, the opposite happens in many different medical systems with doctors, nurses. This could be in just a standard hospital after a baby is born. It could be more in intensive care, maybe in the NICU, or it could be with other types of providers like a breastfeeding specialist, a lactation counselor, IBCLC, or feeding therapists or pediatrician. Um, a lot of times it is thought that if the mother is not producing enough, then they need to supplement immediately without putting a lot of effort or questions or asking parents, what have you tried and, what kind of support would you like to see? Is there ways and strategies that she could produce more if she isn't producing enough? How to encourage that? Because, first of all, number one factor of milk production is stress. And then you tell a mom that she's not producing enough, and then she's going to be more stressed and not produce more. So, how are we supporting families in a positive and encouraging and non judgmental way? And for families that have a child that has some sort of a, you know, challenging start of life, medical trauma, maybe there was difficulty with birth, maybe there's some sort of a genetic condition or other types of congenital physical conditions that they need to have medical support with when they're born. So many of those decisions are taken away from parents because the child needs to be in the care of the medical team. But even something as simple as breast milk, right? If the mom wants to pump, and then are they prioritizing that? And when it's time to feed, if there's a team that's doing, supported learning feeding time for this baby, are they getting the mom's breast milk or are they just using a formula? And I used to work in the NICUs. I've seen this all the time that the medical team, the feeding team would not call the parent for the parent to feed the child, would not assure that we're using the breast milk if the mom was saving breast milk because you have to warm it up and that takes time, or we're just using the standard formula that's provided. And all of those decisions that aren't being asked, that aren't being prioritized for the parent and that child bond, in my opinion, is just malpractice and detrimental. Fortunately, there's been a lot of research and support that have changed a lot of hospital systems to really prioritize parents feeding their baby if their baby is in the hospital, and also to encourage breast milk. And even if it's not that mom's breast milk, do they have milk banks? And it can still be a donor milk if that's the parent's wish and priority and value. So thinking about how to express that, how to communicate that, and how to advocate for that, parents, for your child, but medical providers to ask. Asking is a superpower. Asking is the best strategy that anyone can use in any situation is just to ask. So, a lot of times I've seen this where a family wants to breastfeed and it's taken away from them, that they just use formula. And then there's this like, well, now we just have to use formula because that's what our doctors are telling us. Well, your doctors are telling you, they didn't ask you. And so, if we could promote more of this co construction, asking and trying to build a plan together, I think everybody, and not just the medical team, would be more, you know, confident about the child's health and the parents, but the baby, the child is going to be a lot more benefiting and comfortable because their parents are comfortable. So, in an early stage, that's the basis of, do you want to breastfeed? And if you want to breastfeed, you know, are you making enough or how can you get support to make more breast milk and to have support with that? There's been parents that I've seen for feeding support that they have seen 2, 3, 4, 5 different lactation supports because they were told that it's about, in this case, it was about the mother, like that she was not producing, that the baby was not latching, that it was on the mother's side before somebody referred to a feeding therapist to take a closer look at the baby. And in this case, there's a lot of stress around that. And it's not necessarily because there's feeding challenges that it's just because it's breastfeeding. We need to stop breastfeeding and let's do a bottle. Because that removes so much of that family value and that family's goal. If they had a goal and they wanted to breastfeed. You can also use breast milk through a bottle if a child has a lot of challenges feeding at breast. And so all of these should be conversations, not just telling, because the parents are the deciders for their child. And the medical team is there to support, but not to make those decisions. At least that's my opinion and my stance. And when we get to older children, or we think about some of these decisions of what do we give our children? How do we give food to our children? All of these, again, they don't have to be right or wrong. Let me tell you a story. I was working at a center that supported children that had cerebral palsy and other brain based disability. So they were really complex in their needs. A lot of them were in wheelchairs. Most of them did not talk. Many of them maybe didn't even eat if they had different feeding tubes. And there was this boy, I guess young adolescent, he was 16. And I was coming in for feeding support. And I was talking to his mother and I was asking her, how does he eat? And how do you think that goes? And she says, oh, no, I mean, I don't want to work on feeding. We've done it so long and I don't really care. Like, he drinks from a bottle. That's how he eats. He gets his shakes, his, formula essentially, his nutritional shakes through a bottle. And he drinks through a bottle. And so many years, feeding therapists have been working on trying to get him to maybe drink through a cup, drink through a straw, or learn how to eat with a spoon or different things. And was saying, like, oh, they've worked on this so long. He's never done it. He's never done it. But I got to this point of having a more open conversation with this mom to say, we don't have to work on drinking, or if the bottle works, we don't have to change it. And for her, she just stared at me and she said, what? I said, he does a great job. He can drink through a bottle. You're fine with that. We don't have to change that. And she'd never heard that permission that that's okay, that's okay. And I said, I am just asking as a feeding therapist, is there anything that you would like for maybe him to be able to eat to see if we could work on that? And she said, I would love to be able to like share some cake with him on his birthday or, a muffin or something if she went to the coffee house. And I said, "Cool, let's work on that." And I asked her, "What is important to you?" Asking, not assuming. "Oh, he's drinking from a bottle. We need to change that." Not a priority for her, not a issue. She's not gonna work on it at home necessarily. There's just gonna be the work of whatever that team is to see if they can, get him to advance, and maybe he will a little bit, but it's not gonna carry over. So this is what I'm talking about in terms of assumptions and stereotypes and asking. Another big stereotype that comes out is when families are from different cultural backgrounds, coming from different countries with different types of values and experiences around food. There are lots of cultures in where the adults feed the child and not the child isn't working, from 1, 2 year, 3 years old at feeding themselves. It's just not part of the cultural values or norms. And that doesn't mean it's wrong if they're being fed. There's a lot of cultures that feed with their hands and they don't feed with utensils. That's okay. There's nothing wrong with that, but we need to know that, especially if you're a feeding therapist, to ask these questions, not to just say, "Oh, your child's 3 and doesn't know how to use a spoon. We need to get them to work on that." Are you telling or are you asking? A lot of times I'm overarching different areas. I say different areas that how I can support that families want some support in, and all of these areas might be kind of low priority or not a concern, low priority or higher priority. Where do you fall on these, right? If that is, self-feeding, is that not a priority for you, or is it kind of low, or is it high? And that's fine. They can answer any of those things. And so assumptions and stereotypes often lead to having to correct if it's wrong, or having to or a lot of times people don't necessarily correct. There's authorities, and if people are coming from different countries, if there's different language or even just different norms, many times to speak up or to go against a more of an authoritative figure, in this case doctor to patient, might not be part of, their communication styles. So they're not gonna say anything. I had a family that I was doing feeding therapy with, um, their child who was like 2.5, 2 years old, 2.5, almost 3, and they're from Eritrea, which is a country in Africa, and when I came in, they had gone to a different feeding therapist for an evaluation, and they got some of the recommendations, and then I was going to be their home-based regular feeding therapist. And she said, "Oh, we have the cheese puffs for you." And I said, "What do you mean you have cheese puffs for me?" She says, the barrel of the cheese puffs that I had to get." And I said, "No, I don't know. What are you talking about?" And she said, "Well, that's what we were told. We were told that we have to get this big barrel of cheese puffs for our child so he can eat." And I said, "Okay, do you eat cheese puffs? Is this something that you eat in your family?" She said, "No, I didn't even know what they were, and then I had to, like, go to Costco to find these because they told us that we need to get these for our child." And this is the example, like, nobody explained to her that what they were trying to talk about were these meltable solids, that he didn't eat any solid food, he was still eating purees. So they wanted him to try to eat some of these meltable foods, like a cheese puff that just kind of mushes in the mouth as soon as it gets wet. And instead of explaining the food concept, the food type, and then getting kind of feedback of what kind of foods do the family have that could be like that, they just blanket prescribed cheese puffs as like a prescription here. And so I said, if you don't eat cheese puffs, it doesn't have to be cheese puffs. And then we're just looking for something that kind of melts. Can we look in your kitchen and see what kind of food you have to see if you have anything? Turns out they had like 3 or 4 different types of like rice, puffed rice, crackers, and um snacks that were very, very similar to that texture that we were looking at, and I'm like, "This, any one of these would be fine. That's great. You can give your child these foods." Um, that's what we're looking at. It just needs to melt. And this was the example of not even there was an assumption, first of all, that everybody knows what cheese puffs are from this other provider. There was an assumption that everyone's okay with giving their child cheese puffs. Some people don't wanna give their child all of these processed food or colorants or different kind of chemicals that are in there. Um, or not explaining any of it, of the purpose of it in the first place. And so families that need to advocate for their children in different ways are always the voice of their child. And they are looking out for their child's best interest. That doesn't mean that the providers out there are always looking out for the family's values and best interest. They might be doing kind of the same for everybody or have very limited understanding of different cultures or how they eat, right? A lot of times they'll say, like, "Oh, do you sit in a high chair?" And maybe they don't. Maybe they sit on parents' lap. Maybe they sit on the floor to eat. There's nothing wrong with that. The only thing is to know, like, is this okay? Are you okay with this, or do you want this to look differently? And do you want it to look differently because that's what you want for your family values? You want your child to be able to sit in a chair or to sit at the table? Or you feel like you need to have that because society is telling you that that's what it should be? That, "Oh, I'm told my kid should be able to sit in a high chair, eat at that table, and so I think we need to work on that." If it's not a value for you, it doesn't need to be worked on. If it's not a concern, or if it's in alignment with how you're parenting and choosing to feed your child, and it's successful and it works, it doesn't need to change. It doesn't need to change just because some other, social media or even other medical providers or teachers are telling you that it has to change. There is an 8-year-old boy that I work with who still drinks out of the same sippy cup that he started drinking out of when he was 2. Family doesn't care. He does great with it. He drinks like 4 or 5 cups of water out of that a day, and it works. So they don't need to change it. It's fine. What we want to think about is who's deciding what these changes and supports are. Is it in alignment with the family values, or is it being told without even asking or assuming? Sometimes in the opposite way. People think of families like, "Oh, this is a family from India, and so they must eat all these different types of lentils or garbanzo beans or curries or sauces or anything like that." Or they'll assume, "Oh, they're from India, they're vegetarian." Now, there there's a large population of vegetarian people in India. There's a large population of people in India that eat Indian food, but that doesn't mean that this family necessarily is that way. You can ask. I've had many Indian families that eat a lot and prepare all Indian recipes at home. And I've had other Indian families that just eat everything, right? They maybe eat sushi and macaroni and cheese and peanut butter and jelly and anything. That's not necessarily because they're an Indian family that eat Indian food, or that they're an Indian family that's vegetarian. Maybe they're not vegetarian. Is it being asked or assumed? So what I want you to take away from this is thinking about what are your parent values around feeding your child and how important is that to you for it to be that way? And if it's important to you, it's important to say something. It can be as simple as if a feeding therapist is saying, we need to work on your child learning how to self eat with a spoon. And there are other things that you're working on too, maybe trying to get them to, chew or eat, do nine different foods. And you could say, that's not a priority for us right now. Let's just focus on these other areas. That's fine. You should have a say in what ways, this kind of support is being provided for your child. Same goes, for a pediatrician or for other providers. And if you feel like you're not being heard or you're not even being considered, then, could you say something or could you look for another provider? A second opinion is a great thing. You can get a different experience and maybe you'll find a better fit, a better match of somebody who is more respectful or open or considerate of what are your decisions around your child, not just telling you. And for providers, can we be more intentional about asking? Asking everybody, not just asking because somebody is from this country or from that country or because of this age of the child or that age of the child. Just ask. Put in your standard intake forms, right? Right? Is there different types of food preferences in the family? And you can have on there vegan or vegetarian or don't eat fish or whatever it is. And they could just check box it. And every single person could be asked that, not just because of some different cultural identity. Because when things are assumed that aren't in alignment with our identity, that puts a very big strain on us being able to trust that relationship. Trust is huge. Trust is so important for any type of growth in a relationship. And there are relationships of pediatrician and parent, and then pediatrician and child. But I would say the relationship with the pediatrician and the parent is more important than the relationship with the pediatrician and the child because that parent needs to communicate everything that's going on and needs to carry over any of the recommendations. And trust is so important. Do you feel like you can trust your providers? Do you feel like your different providers, whether that's healthcare providers or education providers, childcare providers, you know, understand what your values are and respect that? Or try to build a plan together, not just telling. That's what I have for you today. I hope that hearing all these things, something resonates. Let me know. And let me know if you have any questions. I'd be happy to talk about this more. But remember, you're doing an amazing job supporting your child on their feeding journey. You've got this. Love, enjoy, and eat.